Hello, I'm Dr. Mugdha Raut, a practicing obstetrician and gynecologist and a clinical reproductive immunologist. We have our centers, Dr. Raut's Center for Reproductive Immunology in Mumbai, Nagpur, Pune, Delhi, Bangalore, and Hyderabad, where, along with my husband, Dr. Mohan Raut, we treat couples of unexplained repeated miscarriages, unexplained IVF failures, and unexplained infertility with the help of lymphocyte immunization therapy and other passive reproductive immunomodulatory treatments. Today, let me explain to you the available treatment options for patients experiencing recurrent miscarriages and the potential risks and the benefits associated with them. So, the treatment of repeated miscarriages itself can be very challenging. Treatment options vary depending on the underlying causes if identified. So let us see the treatment modalities along with the risks and benefits. If there is a genetic problem, the first thing to do is a proper and a thorough genetic counseling with a genetic consultant. Then, depending on the genetic defect, a solution can be given. For example, if there is a defect in the parental karyotype, IVF with pre-implantation genetic testing is suggested. The benefits of this are IVF can help select embryos without genetic abnormalities, potentially reducing the risk of miscarriage. However, IVF is invasive, costly, and it may not address all genetic causes of recurrent miscarriage. The next is if there are any endocrine disorders like a thyroid problem, metabolic disorders like diabetes or PCOS, they should be treated accordingly to overcome the problem of repeated miscarriages. If there are thrombophilia disorders, that is blood clotting disorders, it requires appropriate anticoagulant treatment, and in such cases, low molecular weight heparin preparations are recommended and are required to be used throughout pregnancy. Now, the benefits of the anticoagulant medications are that it not only prevents miscarriages but it also protects them from thromboembolic events and deep vein thrombosis and pulmonary embolism. However, there are some associated risks, like these medications carry the risk of bleeding and require careful monitoring with a doctor throughout pregnancy. The next is autoimmune disorders. If they are responsible for miscarriages, the patient requires immunomodulatory and immunosuppressive therapy with the help of a rheumatologist. Medicines like low dose aspirin, hydroxychloroquine play an important role, and they are very beneficial in cases of autoimmune related miscarriages, but there are some risks. Now, these drugs can have significant side effects and again require very close monitoring. Now, if the cause of recurrent miscarriages is a uterine cause like a septum or a polyp or a fibroid, it can be treated surgically. A weak or an incompetent cervix can be treated by cervical cerclage or taking a stitch to help prevent miscarriage or preterm birth. However, all surgical procedures carry surgical risks and may not be suitable for all cases. Hence, careful selection of a patient is very important. The next is lifestyle modification, which is a very important part of treatment. Lifestyle changes like weight management and stopping smoking in both the partners can improve the pregnancy outcome. However, lifestyle changes take a lot of time to show the results. Next is supportive care. Now, emotional and psychological support is very important during this challenging time. It has been proved that tender loving care or TLC plays a crucial role in decreasing the chance of miscarriage. Now, in spite of correcting all these factors, in 50% of cases of RPL, the underlying cause cannot be found out, and in these cases, immunological rejection of a pregnancy plays an important role. To confirm this, the alloimmune factor, certain immunological tests can be done. The tests that we recommend at our reproductive immunology centers are lymphocyte cross-match, NK cell estimation in the blood, serum TNF alpha, endometrial CD57 cells, and anti-thyroid antibodies. Negative lymphocyte cross-match, raised TNF alpha, raised NK cells in the blood, presence of CD57 cells in the endometrium indicate an alloimmune problem. Now, these patients are then benefited by immunomodulatory treatments. We perform active immunomodulation with lymphocyte immunization therapy or Imulate, which is a patented 3-hour one-time process. After Imulate, the patient is given an individualized protocol of immunomodulatory medications to be taken during pregnancy. The Imulate and the immunomodulatory medications together help the patient to overcome this immunological problem, preventing miscarriages. Now, we are frequently asked this question, then what are the risks involved of Imulate or immunomodulation? There has been a very large study done by Klink from Germany where he has studied the outcome in 4,500 women and the children born thereafter who are given lymphocyte immunization therapy. And he has not found any side effect in the mother or the babies born after Imulate. Now, what are the small risks? There can be minor allergic reactions, but there are no major side effects like any anaphylaxis or a graft versus host rejection. So, lymphocyte immunization therapy, if it is done in properly selected cases, it can give a success rate of almost 75 to 80% with no potential short-term or long-term risks. Thank you.